Bienvenidos. Welcome to everyone again. My name is Jessica Martinez, and I serve as the co-executive director for the National Council for Occupational Safety and Health, also known as National COSH. This is a bilingual event, so we will have translation available in English and Spanish. So, bienvenidos a todos. Mi nombre es Jessica Martinez y sirvo como la codirectora del Consejo Nacional de Salud y Seguridad Ocupacional. También somos conocidos como COSH. Este evento es bilingüe y vamos a tener interpretación disponible en inglés y español. For those of you who are new to the space of National COSH, that you know that we are a movement building network of 25 local coalitions known as COSH groups, which are committees or coalitions on occupational safety and health, typically composed of union and health safety activists, worker centers, public health professionals, family members of victims, injured workers, and others interested in worker health and safety. As a network, we are very dedicated to building the power of workers to assert their rights to earn their living with respect and to be free from harm and abuse. We do this through leadership development, education, organizing, advocacy, and taking action. So our COSH network's guiding principle is that workers who are essential should be essential partners with employers and with policy and decision makers. And what and I want to, thank everyone here for joining us in this two-part event. Just to be clear, we'll have a media briefing and then a planning session for members of our COSH network. We have, it looks like, more than 100 worker advocates, health and safety specialists on our call today. So I want to say a big welcome to everyone for joining us. So I'm going to invite, just in terms of what you should expect for today's agenda. Again, we'll start off with a media briefing about the new vaccine and the testing rules soon to be issued by the Occupational Safety and Health Administration, known as OSHA. And to be clear, this emergency temporary standard, or ETS, has not been released yet. It is currently under review at the Office of Management and Budget. We do not have any advanced knowledge of the precise language that will be included. However, we do know the general framework as announced by President Biden in September, a vaccine or testing requirement for employers with over 100 workers. And we'll discuss what this type of rule will mean for workers, and we'll hear from workers in healthcare, poultry processing, and the retail sector who can tell us what's really happening in their workplaces. At National COSH, we firmly believe that whatever we discuss, health and safety, workers must be front and center and lead the conversation. This is crucial. We have 4 excellent panelists today who I will introduce in a minute. That's the first part of our agenda. Once our panelists have finished speaking, I'm going to invite my colleague, Melissa Moriarty, who will moderate the Q&A session so journalists can ask questions from our panelists. And once we wrap up the Q&A, we'll ask our media guests to excuse themselves from the call, and then we'll proceed with a planning session that will be closed and among the members of our COSH network only. So I want to now transition quickly into our panelists because I know we have quite an ambitious time schedule here. First, we're going to hear from Jordan Barab, who is formerly a senior official at the Occupational Safety and Health Administration, OSHA, and at the House Committee of Education and Labor. Jordan, are you there?
I am here. Can you hear me?
Yes, thank you for joining us.
Good. All right. Well, I'm going to go through basically what we know now, what we don't know, and how we expect this emergency temporary standard to be enforced. So as Jessica mentioned, this is a mandate. It's not, first of all, it's not a vaccine mandate. It is a mandate for workers to either be vaccinated or to be tested on a weekly basis. So it's not a vaccine mandate. And again, as Jessica said, for any businesses with 100 or more employees. We don't know yet when exactly it will be issued. The Las Vegas odds makers are putting their bets on next week, probably early next week. So We know the vaccine is safe and effective, and most importantly, it's clearly justified by the Occupational Safety and Health Act, which requires OSHA to set standards to protect employees, and more specifically by paragraph 6C1 of the Occupational Safety and Health Act that enables the agency to issue emergency temporary standards where there is a grave danger to workers and where that standard is necessary to protect employees. OSHA already issued, as you know, an emergency temporary standard last June. They have established that there's a grave danger. I don't think that's a real question right now. And clearly, I think we all know that, again, the vaccine is safe and effective and therefore necessary to protect employees. And we also are pretty sure it's going to be good for the economy. We've been hearing a lot of warnings that there's going to be mass exodus of workers if this thing goes through, but again, mislabeling it kind of a vaccine mandate. But we think there are actually a lot more workers out there who are afraid to come back to work because they are afraid of getting infected at work, and this should ease many of their worries. We don't really know how long it will be between the time it will be issued and when employers have to come into compliance. The only indication of that we have is the federal contractor guidance that was issued a few weeks ago, and that gave employers essentially about 10 weeks to come into compliance. So we're assuming it'll be about the same, for employees to get their first vaccine, their second vaccine. I'm not sure what the testing requirements will be within that time. All states will have to comply. The Occupational Safety and Health Act, clearly gives OSHA authority over health and safety in all workplaces, including state plans, which have to be at least as effective as the federal law and have to issue standards that are at least as effective as the federal law. And I should say the U.S. law is not ambiguous in this area. We are one nation with one workplace safety and health agency that sets conditions throughout the country, and governors and state officials have no authority to set their own standards in all 50 states. What we don't know. We're not quite sure exactly how the 100 will work, whether it's just company-wide, what's going to happen with franchises, exactly what the religious exemptions may be, how it'll interface with other mandates. For example, the federal contractor mandate has no test option and has no size cutoff and includes remote workers. CMS will probably issue that's the Centers for Medicare and Medicaid Services, will probably issue its standard the same day. That will cover all healthcare institutions in the country that take Medicare or Medicaid, and will likely also have no size limits and no option for testing. So how all that will work together, if you're a federal contractor, if you're in a healthcare institution, how that will work with the OSHA standard, we'll see. Now, I want to finish with what we know about how this will be enforced. First of all, let me say that, like most OSHA standards, this will be largely self-enforcing. Most employers will do what they're supposed to do because that's what employers do, that's what people do, even if there's no cop looking over your shoulder. Just because OSHA may cover 5 million workplaces doesn't mean they have to do 5 million inspections. Secondly, this will be mostly a record type inspection. In other words, OSHA will check employers' records about who's been vaccinated, who's been tested, and what the employer's written program looks like. It'll be fairly simple, which means OSHA will be able to do that either through direct complaints. They will be able to do it along with normal inspections, whether it's for fall protection, machine guarding. They'll be able to check the employer's COVID program. And finally, OSHA will be able to do remote inspections, likely with this. In other words, contacting employers and asking them to prove to OSHA that the standard is actually being complied with. So that is about all of my presentation, and I'll turn it back to Jessica.
Wonderful. Thank you so much, Jordan. As usual, always appreciate your insight. And one thing to note, if you want to know what's happening in health and safely, we highly recommend you visit Confined Space blog, which Jordan is blogger in chief for that blog. So something to note. I'm going to now, we're going to now hear from workers directly, and I'd like to invite Happy Allen, who's a member of United for Respect and a former worker at PetSmart retail facility. Happy? You're muted, Happy. If you could just unmute yourself so we can hear you.
There we are.
Great.
Hello, my name's Happy Allen. I'm joining y'all from Tullahoma, Tennessee, just south of Nashville today. I worked at PetSmart for about 5 years as a dog trainer in my hometown. My mom and dad raised and trained dogs, so I'm pretty much the dog guy around here. I've got 6 of my own that I care for. They all have terminal medical issues. I'm also a veterinary technician. My passion is for taking care of senior dogs and giving them a nice sanctuary retirement home to finish out their journey with us here on the earth. So I take the responsibility of taking care of animals and teaching people about caring for animals very seriously. When I started with PetSmart, I absolutely loved it. I thought, this is the company I want to retire from. Things are great here. They treat animals well. They treat people well. I had enough hours to pay my pets' vet bills, to pay my mortgage. And then suddenly overnight, it seemed like everything changed. PetSmart was bought by a wealthy Wall Street equity firm called BC Partners. When these executives came in, quality pet care and dignity and respect for associates went out the door. I've got to tell this little guy by here. When they started cutting hours, training and pet care equipment just became an afterthought. I often had to help with stocking, pet care, and on the register, which I didn't mind doing, because BC Partners seemed to want us put as much work on as few people as possible. But then when COVID hit, things got really bad. Under BC Partners leadership, the company gave us little to no power to operate our stores in a safe manner. They didn't offer us personal protective equipment in the beginning. Oxivir, which we use to desanitize things in the veterinary industry, has to be left for 5 minutes wet on the surface. And because we were all rushing to get things done, we couldn't even sanitize properly. To make things worse, we had a large number of COVID deniers in managerial positions that thought the masks were a joke. We didn't have those policies enforced between the coworkers, and we were not allowed to enforce masks or social distancing with clients in the stores. PetSmart emphasized, yes, you're essential for sure, but the only essential was to not call out sick. That was especially cruel because pet care coworkers and we have such a commitment to the standards of animal care, and parents trust us with their animals. The only thing they really did was weaponize this part of our job description and our love of animals and our respect for our clients. Because we were so short-staffed, we were without any access to paid leave. People were risking coming into sick work after people who had been sick because they feared getting written up for calling out, which happened several times. There were no social distancing rules enforced in the store and grooming area. However, the rules they came up with were random and arbitrary. For example, in dog training, we weren't even allowed to touch the dogs, shake hands with the parents, touch the animals' leashes, even though parents were promised their dogs would receive quality training. And it was just more evidence for me that they were willing to sacrifice quality for profit. All these factors took a toll on my mental health and especially my ability to support myself. Without question, PetSmart's response to the pandemic was a failure. In fact, one manager in our store district died from COVID early on. To fix things, BC Partners is going to have to listen to associates. When I left PetSmart, I started organizing with United for Respect to help current PetSmart employees find their own voice in the workplace. And I think one of the most important things is that on these large Wall Street firms, we get employee voices on the board. No one should have to go through what I experienced, feeling unsafe and unvalued at work. I'm happy that PetSmart was able to give its workers a $100 bonus, but it's just not enough. There's so much more that needs to be done, including paid COVID time. The coronavirus isn't passed yet, and employees must be required to implement comprehensive safety measures to protect employees and customers. And what we're seeing in the veterinary field is animals now as well. We need strong safety violations like mandated masking, regulations for heat, temperature, sanitizing, ventilation. The 5 to Survive platform demands retail workers also include enforced social distancing, healthy and safe store standards, improved sick leave policies that allow time to recover from any vaccine side effects as well, and a $5 essential pay increase, and a $500 vaccine incentive, as well as protections from retaliation so workers can speak openly about their concerns, which they are not able to currently. Retail workers are called essential heroes. I've heard it 100 times, but we're treated as disposable. and have not been afforded support we need to get vaccinated and survive the pandemic. Simply put, it's time to put people and pets over profit. We urge the administration to take the label essential very seriously and enact health and safety standards to ensure that myself and millions of other frontline workers in all the retail industries like me are safe, protected, and treated with dignity. I appreciate your time.
Thank you, Happy, for sharing your testimony and also for your courage and your energy to continue organizing for you and fellow colleagues in the midst of this ongoing pandemic. So thank you for that reminder as well. It's so important to hear from workers who are facing risk every day on the job. And with that said, I'm going to now invite Maria Elena, who's a poultry plant worker from North Carolina. She's a member of the Western North Carolina Workers Center, who's affiliate of National COSH. And please note that this is a pseudonym to protect her privacy. And also, you know, again, there's real fear in these communities of workers of retaliation. So, Maria Elena está ahí. Si nos puede dar su presentación, por favor, se lo agradecemos.
Hola, buenas tardes a todos. Mi nombre es María Elena. Soy hondureña y soy miembro del Centro de Trabajadores Workers Center del Oeste Carolina del Norte. Vengo a compartirles un poquito sobre el duro trabajo de nosotros los trabajadores en la pollera Cane Farm de Norte Carolina. Yo trabajo en turno de noche. Lo primero que hago al llegar es cortando alas, cortando piernas, a veces los cambian el trabajo, los mandan a embolsar pechuga y embolsar alas. La velocidad de la línea es muy rápida. Ahí es cuando el supervisor viene y los llama la atención, los grita. Cosa que nosotros no podemos mejorar porque la velocidad va muy rápido. En la hora de lonche, solo nos dan 30 minutos para hacer nuestras necesidades o comer. Cosa que no es suficiente porque si vamos al baño no comemos. No nos da tiempo ni de desinfectarlo las manos. También en la línea hay muchos movimientos repetitivos, ya que se los hinchan las manos, los duele la espalda, se los hinchan los pies. También hay compañeros que han tenido accidente en el trabajo, se han resbalado por pisos húmedos, químicos, se han cortado los dedos con tijeras. También las cuchillas nosotros tenemos que afilarlas, cosas que para mí sería mejor que alguien las afilara porque así los perdemos tiempo. También les quiero compartir sobre la vacuna del COVID-19. A nosotros nos brindaron la vacuna, pero no nos dieron información, ya que habían mitos diciendo que las personas podían quedar estériles, las mujeres embarazadas les podía dar cáncer, podía afectar a su bebé. Muchos teníamos miedo de no ponerla, pero aún así por nuestro cuidarnos, la pusimos. Da miedo y tristeza ver que muchos compañeros de nosotros han muerto a causa del COVID, cosa que yo también tuve el COVID, eso no le importó a los trabajadores, ¿cómo le puedo decir? Al patrón no le importó que lo tuviéramos, pero aún así la pusimos, pero no es suficiente porque no tenemos distanciamiento social, no los podemos desinfectar las manos, ya que todos estamos juntos en la línea. Ya por último, quiero pedirles a todos los consumidores que apoyen, llamando a los patrones llamando a los patrones dueños de la compañía, que apoyen a todos nosotros los trabajadores, porque si no ser por nosotros, no tuvieran un plato en la mesa como alimentar a sus familias. Gracias.
Gracias a usted, María Elena. Muchas gracias por su testimonio, de nuevo por su fuerza, por estar aquí y hablar un poquito de su historia. Sé que es una realidad para muchos compañeros de usted y gracias por recordarnos la importancia de seguir apoyando este esfuerzo como consumidores y como personas en este movimiento. Entonces, de nuevo, gracias por su valentía. So now I'm going to invite Ann Barden, who's also like many of the workers here, an essential worker. She's a member of SEIU District 1199 New England. She is a dietary aide and a cook at Trinity Hill Care Center in Hartford, Connecticut. Anne, are you there?
Yes, I am.
Wonderful, thank you.
Good afternoon. My name is Ann Barden. I'm a cook, dietary aide at Trinity Hill in Hartford, Connecticut, and a proud member of the SEIU District 1199 New England. Trinity Hill is a 144-bed nursing home who we care for we deal with drug and alcohol addiction and also HIV and AIDS. I've worked at Trinity since 1986. During that time, I've experienced many serious health and safety issues at work, but the COVID-19 pandemic hit was a whole other story. It showed how much we needed strong OSHA standards. COVID-19 hit our nursing home hard. Half of our residents got sick and many of them died. At one point, half of us were out sick and on quarantine. We were not given proper PPE. We were sometimes given one mask to wear for several days. We had substandard gowns and coveralls, and all were told to share with our coworkers who were on the units that were infected with residents. And it got worse. We found out the company was spraying the masks and the gowns with some sort of chemical. In the other nursing homes, workers were exposed to even more harmful agents. These so-called cleaning chemicals led to the workers being hospitalized. The emotion and physical toll the pandemic had and still is having is beyond belief. We even lost our dear coworker, George. After the peak of the pandemic, OSHA investigated the workers' deaths in the nursing homes. This led to fines against the company. At Trinity Hill and 3 sister facilities, OSHA fined our bosses $60,000. You can't put a price on human life. But without the fines, our bosses have no incentive to do anything for our well-being. We are mostly working class women, Black, brown, and white. The disrespect for our health, our bodies, is something we no longer tolerate. Our fight for healthy and safety is the fight against racism, sexism, and class oppression. It is also fight for human dignity. We welcome OSHA's more aggressive approach. Now we are in much better position to press our case regarding equipment failure, chemical exposure, and refusal to provide appropriate PPE, and we will do so. Our lives and the lives of our patients and families depend on it.
Thank you so much, Anne, for your brave testimony, and also my deepest condolences for the loss of your coworker, George. Again, thank you for reminding us of the importance of workers coming together, also for the lack of real respect for life, penalties of $60,000, as you said. There's no price really for the life of humans. So I wanna thank everyone. Thank you, Anne. And as I said, at National COSH, we always want workers to be at the center of the conversation. So we are very glad that Happy, Maria Elena, and Anne were able to share their stories today. I'm going to take a minute to wrap up here before we move on to the Q&A. First, let me emphasize how important it is for all of us that we reduce the risk of COVID-19 infections in our workplace as we still continue in this ongoing pandemic. Recent data from the Boston University shows that frontline workers will remain a high-risk group during the continuing pandemic. When these workers get infected, the virus can spread to coworkers, family members, and neighbors. Throughout this pandemic, workers have taken the lead in protecting themselves and their families, making demands for better safety and carrying out strikes, protests, and other job actions. In the early months of the pandemic, farm workers in Oregon organized to win better protections from state agencies. Seafood workers in New Bedford organized and achieved citywide rules to limit the spread of COVID. Grocery workers and retail workers in Buffalo created their own set of COVID-19 protocols and convinced major chains to adopt these safety practices. Right now, we're in the middle of the Striketober with workers all over the country rising up to demand not only better wages, but also safe working conditions. Here in California, where I'm based, thousands of healthcare workers are on strike because 19 months into the pandemic, they are burnt out from understaffing and other unsafe conditions. With new rules from OSHA, workers will now have new opportunities. One example is to advocate for vaccines and boosters to be available right at the workplace. The evidence shows this is a positive way to achieve higher vaccination rates. For example, we know that at United Airlines, we're making shots available right at the airports where workers are located, help the company achieve a very high vaccination rate. We know that vaccines are safe and effective, and it's one way, but not the only way to reduce the risk of COVID-19. The data shows that if you are vaccinated, you are 11 times more likely to die from COVID than a person who is vaccinated. But vaccines and testing are just one part of a comprehensive COVID-19 prevention strategy. Here, National COSH and our affiliates are also providing support and information for workers who want to advocate for safety measures that go beyond what is included in this new OSHA emergency temporary standard. We've got a wealth of materials on our website at nationalcosh.org. Shortly, I'm also going to share a link with a resource fact sheet on this emergency temporary standard. A comprehensive COVID-19 prevention strategy should include consultation with workers, improve ventilation, social distancing, mask, and other personal protective equipment provided by employers and other measures. So while we know that vaccines and testing alone won't protect workers, we are alarmed by reports of lawsuits and other actions by state governments to prevent OSHA's new standard from going into effect. So vaccines and testing, we know they save lives. Anyone who stands in the way of workers getting vaccinated is putting politics ahead of health and safety. We should all be focusing on how to do more, not less, for workers who risk their lives during this pandemic. So with that, I want to thank all our panelists. And now I'm going to turn it over to my colleague, Melissa Moriarty, who will moderate the question and answer section of this program. So Melissa.
Thank you, Jessica, and thank you to everyone who joined us. To the reporters who would like to ask a question to any of the panelists, please use the raise your hand feature at the bottom of your screen, which can be found in the reactions button. If you're unfamiliar with that feature, for whatever reason it doesn't work, please then just make sure your video is on and raise your hand so that I can see you and call on you. Okay, Emily Kopp.
Hi, thank you for doing this. I was just hoping, Jordan, you could kind of explain in a case that Happy was describing, if a manager opposes the or defies the vaccine mandate, what sort of recourse does a worker have in that case?
Well, first of all, okay. First of all, again, it's not a vaccine mandate. It is a mandate to either be vaccinated or tested. It's unclear at this point whether workers will have the option to do both, or whether the employer will have sole authority to say either you all get vaccinated, or you're all going to be tested, or you can choose your own. So we'll have to see. In any case, like with any other OSHA standard, when there's a violation, workers can file an OSHA complaint stating that the employer is not in compliance, and asking OSHA to either come out and see, or at least to inquire about what's going on in the workplace, and then OSHA will follow its normal enforcement course.
I was also wondering if you've gotten a sense from the OIRA meetings, what sort of challenges the vaccine ETS could receive from major employer groups or other people who might be opposed.
Well, we weren't, I don't have transcripts of all the meetings, but what we've seen from some of the business advocates is they're asking for a delay. They want it delayed past Christmas because they're afraid it'll cause labor shortages. Some of them are fearing that there'll be a mass exodus from the workplace, which of course is totally contradictory to what we've seen from those companies that have implemented vaccine mandates. And they have a lot of questions about how it will work, which is understandable because nobody quite knows yet. So we'll just have to see. The point is there is some anxiety out there. I would say from my experience with most past OSHA standards, there's actually a surprising amount of corporate support for this as well, especially from companies that have already implemented these and with no major problems.
Gotcha. How significant would punting this past Christmas be? Do you think that would be a mistake?
Well, yeah, Christmas is still what? I mean, where are we? In 2 months away. So if you punt the whole thing past Christmas and wait till then for people to even start getting vaccinated, I mean, that's another 8 weeks. We're still, or at least we were very recently still, experiencing 1,000 deaths a day in this country. So even if the numbers are now going down, we have no assurance that they aren't going to start going up again. And being as almost all of the deaths and hospitalizations have been from unvaccinated people, there are a lot of lives out there that can be saved by implementing this as quickly as possible.
Thank you.
Thank you. And the next hand that I saw up was Mark Greenberg.
Yeah, thank you. Thank you both. One fast question for Maria Elena. You said you wanted people to call the bosses and pressure them, but you didn't say which company. And then the other question is for both Jordan and Ms. Martinez. Yesterday, the House the House Oversight Committee released a comprehensive report on government inaction, corporate inaction against the virus, especially in the meatpacking industry. The number of deaths, the number of illnesses is triple what the reported figures are, so on and so forth. I'm wondering if you could comment on that.
Maria Elena, you want to go first or? All right, well, I'll go first. Well, okay, go ahead.
Llamaran los patrones era de Keynes Bar en Morganton, NC. Sí, me refería a la pollera Keynes Farm de Norte Carolina.
Kings Farm.
Case Farms.
Okay.
Gracias, María Elena.
Case Farms. In North Carolina. Thank you. Okay.
Mark, as far as I haven't actually gotten all the way through the House report yet, but we have I did read the outlines and we know for a fact that there were terrible conditions in many of the meat packing plants in terms of how closely people were working together, the lack of masking and really covering up a lot of the things that could have been done to protect workers, especially in the earlier days of the pandemic. But this raises another issue, which is very important. We really have no idea in this country what the full impact on workers has been of COVID-19. Nobody's really tracking, nobody's counting. Most of the data we have is anecdotal or where, in this case, Congress has actually managed to get some records from some of the larger companies. But unlike the BLS, the Bureau of Labor Statistics, that counts all fatal workplace injuries every year, no one is really counting overall deaths from workplace illnesses, and specifically, nobody is really counting overall deaths from COVID-19 in the workplace and which ones are work-related. That's not an easy thing to do because we don't always know for sure whether COVID-19 was contracted in the workplace or outside. Plus, CDC is not really collecting that information except in a very limited way with healthcare workers. So this is an enormous task, and it's really something I think the federal government needs to focus on, or we're going to be missing some very important lessons for the next pandemic and how that affects workers at work.
Thanks, Jordan, for saying that. I just want to add one piece, which yes, Jordan, an underscore that there is lack of data for workers' infection rates at the work site. However, I can tell you that our network of COSH groups and workers centers and partners who are on the ground connected to a lot of these workers, as you see of our speaker lineup today, through anecdotal data that we know that many of them have been exposed to the virus. due to the lack of protocols, safety protocols at the work site. So we really feel that this, with the release of this ETS will really send a message to the employers of the importance of to remain compliant, that there's still very much, we're in the midst of the pandemic. And as Jordan alluded to, we are still seeing workers getting infected and dying at the work site. We know that some of the industries that are essential, correction facilities, daycare centers, these industries still have the highest rate, the poultry industry, meatpacking industry. And again, no sense of health and safety. Pre-pandemic, these industries already had terrible health and safety records, big risk. And now it's been completely exacerbated with the pandemic. As Maria Elena alluded to, basic needs such as breaks to wash their hands are not being done, access to PPE, mask, and let alone mention that if these workers get up and do not go to work, many of them are in very vulnerable positions of getting no economic relief, no access to unemployment. So it's a really, really tough situation for workers on the ground.
Thank you.
Thank you. And next hand that I saw up is Stephen Wishnia.
Yeah, hi, this is Steve Wishnia from Labor Press in New York City. And I've got two questions. The first is, since I've been covering labor issues in the pandemic for the last year and a half, people, workers have been complaining, lack of PPE, being overworked, lack of safety standards on the job, things like that. But recently, especially with the vaccine mandate in New York City, I've seen some of the unions objecting to it. I'm not sure, for what, whether it's for due process or whether it's because there's, anti-vaxxers in the rank and file. But could someone comment on that? How do you balance that?
I'll start and let somebody else jump in. Yeah, I mean, you're right. We have seen, especially initially, I think earlier, we saw a lot of union resistance to vaccine mandates, mainly because, unions are democratic organizations and they try to, satisfy everyone, which is not always easy. I think we've seen a lot of that resistance melt away with a few exceptions. But the unions are obviously very concerned about being able to still bargain a lot of the details of these programs, exactly how they'll work. And we all know that there's a lot to talk about in terms of how much time you're going to get off, how easy it's going to be, what a lot of the conditions will be for if you have side effects. So there's a lot certainly to bargain there, and I think the unions, want that latitude to bargain. I think, especially, considering the fact again that this is not a mandate, workers can be tested. The other thing I didn't mention that we don't know yet, of course, is who's gonna pay for the testing. We're pretty sure it'll be the employer because that's always been OSHA precedent. But if that's not clear, obviously there's still room to, for bargaining in that area as well.
Yeah, and just to add to Jordan's comment, one of the things that we know is that for unions that have had a proactive role in bargaining for broader safety protections around COVID, we've seen, rates go down. We know, for instance, here where I'm based, for instance, we have the Union for Teachers of Los Angeles, who've adopted pretty comprehensive COVID-19 protocols that protect teachers, support staff, and in addition, students at the school sites. In New York City, we know that 99% of principals, 96% of teachers, and 94% of non-educational employees are now vaccinated. So when you do have more than 90% of workers who want to get a shot and a very small percentage who don't, that's not really a huge divide among workers. So what we're seeing is really the messaging is when you center the conversation about with workers and their needs, you will note that there's not a huge division. And again, these are anecdotes directly from workers that we're talking to from unions and worker centers who want this accessibility, who want the paid time off to be able to access vaccination in addition to paid sick leave. So.
Okay, and the second question I had was, in covering, worker safety, one of the big issues is, I don't have the number in my head right now, but OSHA has a very small number of inspectors for a very large number of workplaces. I forget, it's something like if it would take them 14 years or 70 years or something ridiculous like that to inspect every workplace. So how is that going to affect, how can you practically inspect the majority of workplaces in the country for compliance with this mandate?
Yeah, that figure is 165. It would take OSHA 165 years or somewhere around there to inspect every workplace in the country. As I think I said before, though, just because OSHA covers however many million workplaces doesn't mean OSHA will have to inspect all of those. This will be a fairly easy standard to oversee. Again, all OSHA inspectors really need to know is a list of workers, those who have been vaccinated, those who are being tested, and what the employer's program will look like. A lot of employers will comply, willingly. Again, OSHA inspectors, wherever they're in a workplace or for whatever reason they're in a workplace, can check the program. And OSHA, this is a standard also that will not be difficult for OSHA to conduct remote inspections, just requesting that employers send in proof that they are in compliance, and OSHA will have, it won't be that difficult to check that by talking to workers and checking the employer's records. So although OSHA is incredibly understaffed, even before COVID, they had a hard time with their enormous mandate, considering their very tiny budget. And this isn't going to make it any easier, but I think this will, OSHA will be capable of enforcing this adequately.
So basically they could ask employers, send a list of, your employees who've been vaccinated and the ones who've been tested negative, and then concentrate on, the ones who either refuse or neglect to.
Exactly. And the chances are that OSHA will do that in response to a worker complaint. And in that case, OSHA, the way OSHA does remote inspections now is they will get all the information they can from the employer. If the employer says, no, everything's hunky-dory, OSHA then goes back to the worker and says, the employer says everything's hunky-dory, what do you think? If the employee says, no, that's total BS, then OSHA has the option to go out and do an inspection. But again, usually in those places, the employer will say, either, yeah, we are in compliance and here's the information, and that will be satisfactory, or the employer might say, oh my God, you're right, we're not in compliance, and we'll bring ourselves into compliance. So again, I think it'll be, a minority of cases, obviously, that OSHA has to actually go in and do a physical inspection and issue a citation.
Okay, thank you.
Okay, and I think that is all the time that we have for reporter questions. Jessica, I will toss it back to you.
Wonderful. Thank you, Melissa. And thank you for everyone who's joined us from the media world. We will ask for this second piece of our program, if you could log off. However, if you have additional questions or follow-up that you'd like to do, don't hesitate to reach out to Melissa at nationalcosh.org for any further clarifications, access to the program, etc.